Her complaint started exactly 1 year later. After about a year of problems, she calls me to consult about the issues she's having, and I tell her, Annie, just get on a plane and come. She is very surprised when I tell her, I will solve your problems in 3 days. Hello, I'm Dr. Onur Utku Yüksel from Soho Dental Clinic. I am a specialist in implantology and periodontigy. Many patients come to us unhappy after having had implants done elsewhere. Sometimes they need revision implant surgeries due to uncorrectable aesthetic problems caused by incorrectly placed implants, and sometimes with complaints of pain and infection. In these revision cases, which are much more challenging than operations done from scratch, our greatest happiness is to restore the smiles and self-confidence of these patients who are in a dramatic situation. Now, I want to tell you the stories of revision surgeries for some similar cases. Again, a revision surgery, I want to tell the story of a treatment we performed after another failed implant treatment. However, this case has a special situation for me. This patient's my aunt. She lives in Germany. 2 years ago, she went to a dentist in Germany. She has an x-ray taken and they decide on implant treatment and veneers, and she has her treatment done there. Her complaints start exactly 1 year later. After about a year of problems, she calls me to consult about the issues she's having, and I tell her, Auntie, just get on a plane and come. She is very surprised when I tell her, I will solve your problems in 3 days. How so? Can I get my teeth treated abroad? Is that possible? She asks. Of course it's possible. Then my aunt came, and this is the first image we encountered. The 4 implants we see in the lower jaw. Around them, these white areas we see are inflamed tissues, and there are fractures. In the upper jaw, the gums are inflamed and the smile line is crooked. This is how she came to our clinic. Then we took an x-ray, and this is the picture we saw on the x-ray. I want to talk about the mistakes that were made here. First, these 4 implants were supposedly done as an all-on-4 procedure, but all-on-4 isn't just about placing 4 implants. They must be placed in the ideal way, at specific angles and in specific positions, following biomechanical principles. In this case, 4 implants were placed side by side, only in the front of the patient's jaw, and the teeth were then extended to the back. As a result, every time she chewed, these implants were overloaded and couldn't withstand the pressure. One of them has bone loss, another has a fractured screw, a third has a fracture in the neck of the implant, and here the prosthesis and the implant have completely separated. In the first photo, we already saw that the prostheses were gone. In the upper jaw, however, an implant and natural teeth were connected. We never connect implants and natural teeth, because natural teeth have some mobility within the jawbone, even at a micron level. But an implant never moves. You can't connect 2 structures where one leg is mobile and the other is immobile. And here, inevitably, the mobile tooth structures led to infections and bone loss, resulting in a failed treatment. In just 1 day, within a single day, her surgery was finished, and the next day she returned to Germany with her temporary teeth. Here's the image of the previous implants and treatment. And this is the image of what we did afterward. There are very subtle details between the 2 photos. I'd like to talk a little about them. For example, the implants in the front were placed at an angle, extending them toward the chewing areas in the back. And the implants were chosen to be long and strong, designed to support the load of the entire jaw. These black dots we see here are the openings where my aunt's nerves exit. And by positioning the implants as close as possible to these openings, we provided maximum support to the chewing area. In the upper jaw, the sinuses, the cavities in the upper jawbone were sagging. So we placed 4 long implants at ideal angles, getting support from the nasal floor and positioned for maximum contact with the sinus. Just 1 day later, fixed temporary teeth were placed on them. Afterward, my aunt returned to Germany for a 3-month healing period. When she returned to our clinic after 3 months, we were able to create and fit the permanent dental prostheses that you see here. And we accomplished this entire process in just 1 week, which is quite remarkable. Now, her comprehensive dental treatment is fully complete, and she is extremely happy, radiating joy and filled with a renewed sense of self-confidence and self-assurance. Here, we can observe the X-ray image of the dental implants that we carefully placed for our patient, which is then followed by a view of her beautiful, confident smile. Finally, we bring the treatment to a close with my aunt's truly beautiful and radiant smile, which is a testament to the success of the entire process. In conclusion, we don't just sell implants. With years of experience, we provide a complete surgical and prosthetic treatment. I will continue to explain these revision treatments in detail like this. Thank you. When patients choose a clinic, their goal shouldn't be just to buy a good brand of implant for the cheapest price. It should be to find an experienced team they can trust to perform such a delicate surgery. Don't leave it to chance and gamble with your health at inexperienced clinics that only focus on cheap prices. If you think you need implant treatment, or if you have any issues with your existing implants, please don't hesitate to schedule an online consultation with us.